Hello guys, my name is Anita Luanga. I'm an exercise physiologist, internist, and geriatrician. In this video, I'm going to be talking about how doctors differentiate in between heart attacks and panic attacks. So with a heart attack, an individual might complain about chest pain, shortness of breath, and feeling shaky. And some of these symptoms might be present in an individual that is having a panic attack. First of all, we will talk to the individual and get a little bit more information about when the chest pain started, what triggered it, what makes it better. We will also risk stratify the patient or the individual based on several risk factors such as their age, past medical history, and their social history. If they fall into the high risk category or medium risk category, they will get additional tests, specifically a troponin and ECG. Troponin is a blood test that tells us if there's an enzyme leaking from the heart. Based on those findings plus the patient's story, we can determine if they're having a heart attack. If things are still a little bit ambiguous, there are additional tests that the individual might get to determine if they are indeed having a heart attack. Now, with a panic attack, an individual might still get an ECG and the troponin blood test, and then if that confirms that they're not having a heart attack, we will likely go back and ask more questions, which will help us then determine if an individual is actually having a panic attack. The reason that an individual that might be having symptoms that look more like a panic attack might get the tests that an individual with a heart attack would get is because ruling out a panic attack or confirming the diagnosis of a panic attack can sometimes be a little bit difficult, and it is quite serious and dangerous to miss a heart attack. In the next video, I'm going to talk about how heart attacks and panic attacks are treated.